With baseball tournament season coming up, we want to cover one of the main injuries that we see here in the clinic, and that is little leaguer's elbow. Little leaguer's elbow is described as an overuse injury to the medial side of the elbow. It is a particularly concerning case for us because we don't want to, with skeletally immature athletes, there's a growth plate in there, and we don't want to disrupt that.
When looking at the research surrounding little leaguer's elbow, one of the things we frequently hear anecdotally is the way that different pitches stress the elbows differently and how that impacts overuse injuries. But the research itself actually does not support that. What we see when it comes to little leaguer's elbow is that the primary contributing factors are pitch count, number of pitches thrown in an outing, time between outings for pitchers, and then body mechanics related to their pitching, right? So we can see that the amount you're pitching is far more significant than the pitches you're throwing. And so in our videos this month, we're going to cover ways to manage load and reduce the likelihood of you running into these issues.
Okay, now for load management, there's a lot of ways that we can approach this. The most common thing that we see is pitch counts. Pitch counts are really important for our pitchers. You'll see some discrepancy in what the pitch count should be. One research article that we went off of showed after 600 pitches in a season, injury rates more than doubled. So thereabout in that ballpark is probably where we should be shooting for. Other management techniques to reduce load would be not pitching on multiple teams, make sure we have dedicated off seasons where we're not having any throwing, and then days that we do have off from pitching that we're not playing throwing intensive positions. So positions like catching would be good, first base. Basically, we're not repeating stress in this area similar to our pitching. Okay, now second most important thing that we want to cover, secondary to load management, that is body mechanics. There's a lot of mechanics in a throwing athlete. One of the most commonly overlooked mechanics in a throwing athlete is lower extremity. So a lot of our focus, we're always diagnostic when we're looking at elbow and shoulder and making sure we don't have structural injury like we've covered. We want to make sure that the whole body mechanically is sound. So when we have these athletes come in the clinic, we're always going through a full lower extremity assessment from ankle all the way up to shoulder complex and even neck range of motion. So there's a lot that goes into proper body mechanics. So when we separate proper body mechanics from athletic mechanics, those two things are very different. So we always like to define what we're trying to do with our athletes when they're here in clinic.
So to wrap up this month's blog, we talked about the myths behind little leaguer's elbow. We know what causes it now, and it's not necessarily pitch type. It's a lot of overuse. We covered load management, and that's a lot of stuff that you can do at home and with your coach. And then the last video that we just went over was talking about what we can do and working on the kinetic chain and making sure that the lower half of the body is functioning. So what we want to really emphasize is this is a thing that we want to address early and address it quickly and make sure that there's no disruption in those growth plates. So if you're needing help and are having pain multiple days in a row, that is a sign that we need to address the elbow at a very rapid pace.